প্রিয় শিক্ষার্থীবৃন্দ, সবাইকে আমার একটু ভিডিও চ্যানেল উইলাইক অ্যানাটমিতে স্বাগত জানাচ্ছি। আজকের আলোচনার টপিক হচ্ছে পেরিকার্ডিয়াম। এই ভিডিও মূলত আমার ফরেন স্টুডেন্টদেরকে টার্গেট করে তৈরি করা হচ্ছে। এই কারণে আজকের এই ভিডিওতে আমি বাংলার পরিবর্তে বেশিরভাগ ক্ষেত্রে ইংরেজি ভাষা ব্যবহার করব। But first, we want to know the learning objectives of this class. At the end of the video, the students will be able to define pericardium, state the structure of the pericardium, state the blood and nerve supply of the pericardium, enumerate the developmental source of the pericardium, enumerate the contents of the pericardium, define pericardial space or cavity and pericardial sinuses, and enumerate some clinical anomalies of the pericardium. So let us start one by one following our learning objective. At first, definition of the pericardium. Here we can see this is the heart, and outside the heart this is the pericardium. Actually, pericardium word comes from peri and cardium. The prefix peri means around, and the Greek root cardia means heart. So pericardium means something around the heart. The simplest definition of pericardium will be outermost covering of the heart. So we can say the outermost covering of the heart is called pericardium. Now, if we want to elaborate the definition a bit, then we can say outer fibroserous covering of the heart and root of the great vessels. Now let us explain all the words here. It is the outer covering, okay. It is fibro, that is one layer of this covering is fibrous tissue. It is made by fibrous tissue. And the other layer of this structure is serous tissue or serous membrane. So it is both fibrous and serous. That's why it is called fibroserous covering. It covers heart as well as root of the great vessels. We can see in this picture, this is the pericardium. Inside the pericardium, we can see here it is the pulmonary trunk. Here is the ascending aorta. Here is the superior vena cava. That means pericardium not only covers the heart, it also covers root of the great vessels. So the other definition of pericardium will be outer fibroserous covering of the heart and root of the great vessels is called pericardium. There will be another definition. Pericardium is a fibroserous sac that encloses the heart and root of the great vessels. Now, where pericardium is located? Actually, pericardium is located around the heart. It is like an apron, or it is like our dress. We can compare heart with our body. Suppose our body is the heart and we wear some cloths around our body. These cloths are the pericardium. So, heart is located in the thoracic cavity. Good. Heart is located in a special area of the thoracic cavity which is called mediastinum. Again, heart is specifically located in the middle mediastinum. So, pericardium will be also located in the middle mediastinum. That's why we can say pericardium is located or situated in the middle mediastinum. Now, what is the structure of the pericardium? Let us explain from the developmental aspect. Suppose this is a serous membrane and inside the serous membrane there is a cavity. It is a cavity containing serous fluid. Suppose this is the pericardial cavity and containing pericardial fluid. And this is the developing heart with root of the great vessels. Now we can see the heart is invaginating into this serous pericardium or this serous membrane. Now it is more invaginated. Now we can see it is completely invaginated, the serous membrane. Now we can see the serous membrane is divided into two layers. And the cavity, here is the cavity, that was the pericardial cavity. It is reduced to a very thin space. It is a potential space. This space is pericardial cavity. Once it was very larger, but now it is reduced to a potential space only. However, one layer of the serous membrane is closely applied over the heart. This is called visceral layer of the serous pericardium. Another layer is located outside. It is called parietal layer of the serous pericardium. And in between them, there is the pericardial cavity containing pericardial fluid. In our body, there are some other serous membranes like peritoneum, pleura, then synovial membrane. All those serous membranes are very soft and delicate structure. So they need protection. They need protection by something hard structure. That hard structure is the fibrous pericardium. Look at this picture. Here is the heart, and over the heart, this is the visceral layer of the serous pericardium. And this layer forms the outermost layer of the heart, which is called epicardium. And outside the epicardium, there is the pericardial cavity containing pericardial fluid. And this is the parietal layer of the serous pericardium. And to give protection to the serous pericardium, here is the fibrous pericardium. This is a tough tissue. It is called fibrous pericardium. It gives protection to the heart, to the serous pericardium, and it performs some other functions. Now we can see what will be the structure of pericardium. Externally, this is the fibrous pericardium, and internally, there is serous pericardium. That's why pericardium is a fibroserous covering. Serous pericardium has two layers. One is called parietal layer, which is closely attached to the inner aspect of the fibrous pericardium. Another layer is visceral layer of the serous pericardium, which forms outermost layer of the heart, which is called pericardium. Now we can show another animated diagram. Suppose this is the fibrous pericardium and this is the serous pericardium. Serous pericardium has two layers. This is the parietal layer. Parietal layer and fibrous pericardium, they are blended intimately. They are fused to each other, and the fused structure, if we want to examine, we can see outer aspect of this fused structure will be rough because this aspect contains fibrous pericardium, but the inner aspect of this fused structure will be smooth because it is the parietal layer of serous pericardium. Any serous membrane is very smooth in nature. So inner aspect of this fused structure will be smooth. This is the pericardial cavity and this is the visceral layer of serous pericardium which is applied over the heart and it forms outermost layer of the heart which is called epicardium. Now one thing, do you think that heart is located inside the pericardial cavity? No, heart is actually not located within the pericardial cavity. Pericardial cavity contains only fluid, that is pericardial fluid. Heart is located inside fibrous pericardium, so it is intrafibrous, but it is not located inside pericardial cavity. Pericardial cavity is formed by serous membrane. That's why heart is extraserous. That means it is located outside serous membrane but inside fibrous membrane. Heart is intrafibrous but extraserous. Now, what are the functions of the pericardium? We can divide the functions into two groups. What are the functions of fibrous pericardium and what are the functions of the serous pericardium? Fibrous pericardium at first protect the heart. I have told earlier, it gives protection to the heart. It prevents excessive movement of the heart. It limits the cardiac distension and it also protects the serous pericardium. So, the fibrous pericardium protects heart as well as delicate and sophisticated serous pericardium. Fibrous pericardium restricts excessive movement of the heart and limits over distension of the heart. Now, what is the function of serous pericardium? Actually, serous pericardium serves as a lubricated container in which heart can contract and relax smoothly. So, these are the functions of the pericardium. Now, we want to describe the fibrous pericardium. In this picture, here is the fibrous pericardium. This is the fibrous pericardium. Okay. Fibrous pericardium is a conical. It looks like a cone. So, this is conical, strong fibrous sac that supports the delicate serous pericardium. That is the main function of the fibrous pericardium. It protects heart. It protects the delicate serous pericardium. And the fibrous pericardium fuses with the vessels, like this is a vessel. Here we can see fibrous pericardium fuses with the vessel which enter or leave the heart. The parietal layer of the serous pericardium, here it is the parietal layer of serous pericardium. This layer is intimately and firmly blended to the inner surface of the fibrous pericardium. And I have told earlier that the fused structure's outer aspect is rough because it is formed by fibrous pericardium, and the fused structure's inner aspect will be smooth because it is formed by serous pericardium, specifically parietal layer of the serous pericardium. So, fibrous pericardium is conical in shape. It has an apex. Here is the apex of the fibrous pericardium. The apex is blunt and it is located at angle of Lewis or sternal angle. So, apex of the fibrous pericardium is located at the level of sternal angle. And opposite the apex, there will be a base. So, This is the base of the fibrous pericardium. And the base of the fibrous pericardium is definitely broad. We can see this in this picture. And it is inseparably blended with the central tendon of the diaphragm. This is the diaphragm and this is the central tendon of diaphragm. So, base of the fibrous pericardium is intimately blended with central tendon of the diaphragm because both fibrous pericardium and central tendon develop from same source and have same nerve supply. That source and nerve supply will be told later. Just wait. Now, here is the heart and this is the fibrous pericardium, this greenish structure. This is the anterior aspect. Here is the sternum. This is the manubrium sterni. This is the body of the sternum. And here is the xiphoid process. Okay. This is the posterior aspect of the heart. Now, anteriorly, this fibrous pericardium is attached to the sternum by two ligaments. One is called superior sternopericardial ligament. This ligament connects the fibrous pericardium to the posterior aspect of manubrium sterni. Another one is inferior sternopericardial ligament, which attach the fibrous pericardium to the posterior aspect of body and xiphoid process. So anteriorly, fibrous pericardium is connected to sternum by two ligaments, superior and inferior sternopericardial ligament. Posteriorly, if we see the posterior aspect here, posteriorly, few structures are related to the fibrous pericardium. Number one, right and left principal bronchus. Number two, esophagus. And number three, descending thoracic aorta. So, posteriorly, fibrous pericardium is related to these three structures. Now, on each side, we can see this is the heart and the golden structure over the heart is the pericardium. Suppose this is the fibrous pericardium because it lies externally. And which structures are located lateral to the fibrous pericardium? We can see this is the lung and this is the mediastinal surface of the lung. Again, the covering of the lung is called pleura. This is the costal pleura. This is the diaphragmatic pleura because it is located over the diaphragm. This is the mediastinal pleura. And the pleura covering the apex of the lung is called cervical pleura. So, just lateral to the fibrous pericardium, we can see there is mediastinal pleura and mediastinal surface of the lung. But in between the fibrous pericardium and mediastinal pleura, two more structures are present. One nerve and one blood vessel. The nerve is the phrenic nerve. We can see this is the right phrenic nerve. This is the left phrenic nerve. And blood vessel is the pericardiophrenik blood vessel. These are the pericardiophrenik blood vessel. Here is the right pericardiophrenik blood vessel. These are the left pericardiophrenik blood vessels. So, the lateral relation of fibrous pericardium will be at first mediastinal pleura, mediastinal surface of the lung, and in between the fibrous pericardium and mediastinal pleura, there will be phrenic nerve and pericardiophrenik vessels. Now, Source of development with nerve supply of fibrous pericardium. Fibrous pericardium develops from the septum transversum. It is a mesodermal partition lying transversely, and it separates abdominal cavity from the thoracic cavity. That's why it is called septum transversum. From the septum transversum, central tendon of the diaphragm, fibrous pericardium, trauma of the liver develop. So we can say fibrous pericardium develops from the septum transversum. And also central tendon of the diaphragm develops from septum transversum. That's why both the central tendon and fibrous pericardium are inseparably blended to each other. So if one asks why fibrous pericardium is attached to the central tendon of the diaphragm, the answer will be both of them develop from the septum transversum. And the nerve of septum transversum is the phrenic nerve. That's why diaphragm as well as fibrous pericardium. That's why diaphragm and fibrous pericardium both are supplied by the phrenic nerve. So the source of development of fibrous pericardium is the septum transversum, and the nerve supply is the phrenic nerve. Phrenic nerve is formed in the neck from the cervical plexus. Its root value is cervical 3, 4, 5. There are two phrenic nerves. This is the right phrenic nerve and this is the left phrenic nerve. The nerves after formation descend downward, then enter the thoracic cavity through the inlet of the thorax. That is thoracic inlet. Then the nerve passes downward through the superior mediastinum, then through the middle mediastinum, in between fibrous pericardium and mediastinal pleura, along with pericardiophenic blood vessel. Then the right phrenic nerve enter abdomen through the vena cava opening of the diaphragm, and the left phrenic nerve enters abdomen directly by piercing the left dome of the diaphragm. So both phrenic nerves are now in the abdominal cavity. In the abdominal cavity, the phrenic nerves divide into four branches like medial branch, lateral branch, anterior branch, posterior branch. And these four branches supply the diaphragm and some other structures. So that is the course of the phrenic nerve. From this picture, we can see right phrenic nerve is shorter, more straight, whereas left phrenic nerve is longer and it is oblique in course. It is not straight, it is longer. Right phrenic nerve enters abdomen through the vena cava opening, but left phrenic nerve enters abdomen directly by piercing the left dome of the diaphragm. One more thing, phrenic nerve is a mixed nerve. It contains both motor fibers for the diaphragm and sensory fibers for diaphragm, that is central tendon of the diaphragm, fibrous pericardium and some other structures. Now, blood supply of the fibrous pericardium. We want to see fibrous pericardium from two aspects, anterior and posterior. Anterior aspect of the fibrous pericardium is related to the thoracic wall, and thoracic wall is supplied by internal thoracic artery and musculophrenic arteries. So, anterior aspect of the fibrous pericardium will be supplied by internal thoracic artery and musculophrenic artery. But posterior aspect of the fibrous pericardium, we know fibrous pericardium is posteriorly related to descending thoracic aorta. So, posterior aspect of the fibrous pericardium will be supplied by pericardial branches of the descending thoracic aorta. So, that is the blood supply of the fibrous pericardium. So, we have learned about the source of development, blood supply, nerve supply of fibrous pericardium. Now, what about serous pericardium? Let us see the picture here. This is the heart, and innermost layer of the heart is endocardium. The middle layer is myocardium. The outer layer is epicardium. Actually, this epicardium is formed by visceral layer of serous pericardium. So, visceral layer of serous pericardium forms outermost layer of the heart. Then, this is the pericardial cavity, and outside the pericardial cavity there is the parietal layer of serous pericardium, and this is the fibrous pericardium. Serous pericardium has two layers. The outer one is the parietal layer, which is closely blended with inner aspect of the fibrous pericardium, and the inner layer is called visceral layer. This visceral layer is adherent to the outer surface of the heart and forms the outer layer of the heart, which is called epicardium. Now, what is the source of development, nerve supply and blood supply of serous pericardium? Serous pericardium has two layers. One is called parietal layer. Any parietal layer of any serous membrane will develop from the somatopleuric layer of lateral plate mesoderm, like parietal layer of the pleura, like parietal layer of the peritoneum, like parietal layer of the synovial membrane, all develop from the somatopleuric layer of lateral plate mesoderm. So, our parietal layer of serous pericardium develops from somatopleuric layer of lateral plate mesoderm. But one more thing, this layer is closely applied or blended with the inner aspect of the fibrous pericardium. And fibrous pericardium, as it develops from the septum transversum, and the nerve of septum transversum is the phrenic nerve, that's why this parietal layer of serous pericardium will also be supplied by phrenic nerve. Understand? Is there any problem? Fibrous pericardium and parietal layer of serous pericardium, they develop from two different sources. One from septum transversum, another from somatopleuric layer of lateral plate mesoderm. But they are closely blended to each other, forming a single layer. That's why both of them are supplied by phrenic nerve. Both of them have same blood supply. What will be that blood supply? Internal thoracic artery, musculophrenic artery, and descending thoracic aorta. Now, what about the visceral layer? Visceral layer, it is now part of the heart. It forms the outer layer of the heart, which is called epicardium. Heart is a viscera, and heart develops from splanchno-pleuric layer of lateral plate mesoderm. So, visceral layer of serous pericardium will develop from splanchno-pleuric layer of lateral plate mesoderm. Remember, splanchno means viscera. So visceral layer will develop from splanchnopleuric layer of lateral plate mesoderm. Now, what will be the nerve supply of visceral layer? Visceral layer is now part of the heart. Heart is supplied by autonomic nervous system. That means heart is supplied by autonomic nerves. Similarly, visceral layer of serous pericardium will be supplied by autonomic nerves. One more thing, what will be the arterial supply of visceral layer? As visceral layer is a part of the heart, heart is supplied by coronary arteries. So visceral layer will be supplied by coronary arteries. It is a part of the heart. Now we want to see the summary. Sometimes in the written exam a question come. The question is write down the layers, source of development, blood supply and nerve supply of the pericardium. So there are two layers, fibrous and serous. Fibrous pericardium develops from septum transversum. Serous pericardium has two layers, parietal and visceral layer. Parietal layer develops from somatopleuric layer of lateral plate mesoderm. Visceral layer develops from splanchnopleuric layer of lateral plate mesoderm. These two layers, that is fibrous layer and parietal layer, they are closely blended to each other. That's why their blood supply and nerve supply are same. But visceral layer of serous pericardium, which forms the outer layer of the heart, which is called epicardium, it is supplied by coronary arteries and it is supplied by autonomic nerves. So this is the summary. You can answer in the exam by giving this tabulated form. Before, you must write the layers of the pericardium, source of development here, arterial supply, nerve supply here. Now, what are the contents of the pericardium? We can see this is the pericardium, this is the fibrous pericardium. What structures are located within the fibrous pericardium? That is the contents of pericardium. The definition of pericardium was the outer fibroserous covering of the heart and root of the great vessel. That means pericardium covers heart and root of great vessels. So, what will be the contents of the pericardium? Number one, heart. And along with the cardiac nerves and blood vessels. Number two, great vessels. What are those great vessels? This is the ascending aorta. Ascending aorta is located inside the pericardium. This is the pulmonary trunk. Pulmonary trunk is located inside pericardium. This is the superior vena cava. The terminal part of the superior vena cava or the lower part of superior vena cava is contained within the pericardium, and the terminal part of the inferior vena cava is enclosed by the pericardium. And finally, four pulmonary veins. The terminal parts of four pulmonary veins, they are also located within the pericardium. So, these are the structures within the fibrous pericardium. Now, pericardial space or pericardial cavity. Here is the fibrous pericardium. This is the parietal layer of serous pericardium. This is the visceral layer of serous pericardium. In between them, there is a potential space. This is called pericardial space or pericardial cavity. This space contains a fluid. This is called pericardial fluid. The amount of fluid is not more than 300 ml. So the normal amount of fluid is 300 ml. This is the pericardial fluid. Now, what is the sinuses of pericardium? There are two types of sinuses of pericardium. One is called transverse pericardial sinus. Another one is oblique pericardial sinus. At first, transverse pericardial sinus. We can see here, this is the pulmonary trunk arising from right ventricle. This is the ascending aorta arising from left ventricle. These are the arterial component. On the other hand, this is superior vena cava, and behind the heart there will be four pulmonary veins. Superior vena cava, inferior vena cava, four pulmonary veins, all are the venous components. The epicardium at the root of the great vessels is arranged in the form of two tubes. One is called arterial tube. Arterial tube encloses ascending aorta and pulmonary trunk at the arterial end of the heart tube. And the venous tube encloses vena cava and pulmonary veins at the venous end of the heart tube. The transverse passage between two tubes is called transverse pericardial sinus. Here the finger is inserted in the transverse pericardial sinus. So the transverse space in between arterial tube and venous tube, that is called transverse pericardial sinus. Actually, it is a horizontal gap between the arterial and venous ends of the heart tube, and it is bounded anteriorly by the ascending aorta and pulmonary trunk, posteriorly by the superior vena cava, and inferiorly by the left atrium. On each side, the transverse pericardial sinus opens into general pericardial cavity. Now, what is the clinical importance of transverse pericardial sinus? During open heart surgery, a ligature may be passed through the transverse pericardial sinus around the ascending aorta and pulmonary trunk to control bleeding, to control hemorrhage. That is the clinical importance of transverse pericardial sinus. One more sinus is present here. It is called oblique pericardial sinus. Here is the oblique pericardial sinus. It is a narrow gap and it is called cul-de-sac behind the heart, especially left atrium. So behind left atrium, a narrow gap is present. This is called oblique pericardial sinus. Anteriorly, it is bounded by the left atrium because it is present behind left atrium. So anteriorly, left atrium will be present. Posteriorly, there will be parietal pericardium, that is parietal layer of serous pericardium, and esophagus. On the right and left side, it is bounded by reflections of the pericardium. Below and to the left, the oblique pericardial sinus opens into rest of the pericardial cavity. Now, what is the importance of oblique pericardial sinus? This oblique pericardial sinus permits pulsation of the left atrium to take place freely. For free pulsation of the left atrium, this oblique pericardial sinus is very helpful. Now we want to see some clinical anatomy related to the pericardium. These are pericarditis, pericardial effusion, pericardiocentesis, pericardial rub or pericardial friction rub, and pericardial or cardiac tamponade. I will discuss these things gradually. At first, pericarditis. The term pericarditis comes from pericardium plus itis. Itis means inflammation. That means inflammation of the pericardium is called pericarditis. In this picture on the left side, this is the normal pericardium, but on the right side, pericardium is inflamed. So here, this is a case of pericarditis. There are a lot of types of the pericarditis like acute pericarditis, chronic pericarditis, restrictive pericarditis, constrictive pericarditis, then incessant pericarditis, then recurrent pericarditis, infectious pericarditis, and if the infection occur by the TB organism, then it is called tuberculous pericarditis. Then traumatic pericarditis, uremic pericarditis, malignant pericarditis, purulent pericarditis, and finally, if there is no cause of pericarditis, but pericarditis is there, then it is called idiopathic pericarditis. Now pericardial effusion. We know normally 300 ml of fluid is present in the pericardial cavity, and that fluid is called pericardial fluid. Increased amount of the pericardial fluid above normal level is called pericardial effusion. Now pericardiocentesis. Withdrawal of pericardial fluid from the pericardial cavity for diagnostic or therapeutic purposes is called pericardiocentesis. Pericardiocentesis is done by the three approaches. One is called parasternal approach. This is the parasternal approach. In this case, a needle is inserted through the fifth intercostal space just above the upper border of lower rib, 1 centimeter lateral to the lateral margin of the sternum, and the needle is inserted into pericardial cavity to withdraw pericardial fluid. This is parasternal approach. Another approach is called subxiphoid approach. In this case, a needle is inserted between xiphoid process and left costal margin, and the needle is inserted into pericardial cavity to withdraw pericardial fluid. And finally, apical approach. In this approach, a needle is inserted just lateral to the apex beat and inserted into pericardial cavity to withdraw some fluid. So this is called apical approach of the pericardiocentesis. Now pericardial rub or pericardial friction rub. It is a grating to and fro sound produced by friction of heart against the pericardium, and this sounds like sandpaper wrapped on wood. Such a sound usually indicates pericarditis. When heart moves during systole and diastole, then these two rub surfaces friction to each other and produce such rough sound, and that is called pericardial rub or friction rub. Finally, pericardial or cardiac tamponade. It is a medical emergency that takes place when abnormal amount of fluid accumulate in the pericardial sac. Pericardial sac means pericardial cavity, compressing the heart and leading to decrease in a cardiac output and shock. That means normally we know 300 ml of fluid is present in the pericardial cavity. If the amount increases, then it is called pericardial effusion. If pericardial effusion is of greater extent, that The fluid compress the heart and decrease cardiac output. Then this condition is called pericardial tamponade or simply cardiac tamponade. Beck's triad of physical findings of pericardial or cardiac tamponade are, there are three findings. One is hypotension, then jugular venous distension, and muffled heart sound. These three components forms the Beck's triad of physical findings of pericardial or cardiac tamponade. And that is the all about my video on pericardium today. Thank you very much. And please subscribe my channel We Like Anatomy by clicking the bell icon. And please write something in the comment box about the video, how you enjoyed it, what were the contents of the video, and agara bagara. So take care, goodbye.